16 days I laid up there in the cardiac unit with people that had open heart surgery. They had to have a special team come from a different hospital that they gave me a PICC line because you couldn't hit any of my veins, and like the special response team at the hospital would be called every time they needed to give me a new IV, and they were having trouble doing it also, and like that was their job, that's what they did at the hospital, and they still couldn't give it to me. So they came and they had to put a PICC line into my heart, directly in my heart, and like the insanity of it all is, while I was laying there from the surgery, almost dying, I thought that would be a great way to get those drugs into my system, and if only I had them.
Overall, in the U.S., there are 2.1 million people a year that overdose on drugs. Since 2009, the drug overdose rates involving heroin have increased dramatically, not only in the United States, but specifically in Kentucky. Why has heroin become the drug of choice to so many people? The House Bill 1 was passed in 2012, which made doctors screen patients for drug use, enter the patient's information into a database to make sure that the patients were not going from doctor to doctor to get more pain prescriptions. Because of these changes, doctors have not written as many prescriptions for pain medications, making it harder for patients to abuse these drugs. However, this is not all good news. We are now living through the repercussions of this bill. Heroin has become an epidemic. In 2015, the number one drug that caused death by overdose was heroin.
I've only been in my position over here at the clinic since October. Prior to that, I've spent the last 5 years over at UK Healthcare's hospitals, so Good Sam Hospital and Chandler Hospital, where I served as the drug and alcohol counselor there. And I would say I've seen a significant increase in the drug overdoses, specifically right around 2012, 2013. There was a House bill that was passed, House Bill 1 that was passed, that changed how prescription drugs were administered kind of throughout the state. And shortly after that, we saw a really increase in heroin. And even though there were a significant amount of overdoses prior to 2012, when heroin became more widespread throughout the state, we started seeing a significant increase. The other thing we saw increase was intravenous drug use. And so when you have those two things, the combination of heroin, which tends to get cut with a lot of fentanyl and other drugs, and in a faster administration route of administration, which is the intravenous drug use, we started seeing a real significant increase in overdose deaths, or overdoses in the hospital. Not always just deaths, but and so there's been a lot of preventative measures throughout the state. Police officers and paramedics and ambulances are now carrying the Narcan kits, and those are also being prescribed to sometimes family members.
I went to talk to Battalion Chief Brian Wood about Narcan and its reverse effects against an overdose.
All the police in Lexington carry this. It's opioid overdose kit, and I think it's kind of similar to what you can purchase in the stores. A lot of parents will buy it because they have children or loved ones that are addicted, so they want to keep it around. I believe the hospitals are giving it out to a lot of the addicts so they can have it. And we're like I said, we're an ALS unit, so we carry the actual drug IV. We don't carry kits like this. We carry the actual drugs out in our supply kits. But yes, it's on all of our trucks.
Do you see some of the same people with reoccurring overdoses?
Daily we see them. We know who they are before we ever get there. The problem with heroin is, and Narcan is the antidote for heroin, but Narcan doesn't last as long as the heroin does, so it's distinctly possible for a person to be overdosed on heroin. We give them Narcan, wake them up, they check out of the hospital, and then they overdose again without ever taking any more heroin. So we have to come back and get them again. Some people just know that we're there, and they're very lackadaisical in their use.
An overdose is one of the many health concerns for someone who has a drug addiction. However, taking drugs can cause many other health problems, including serious infections from IV use. So I went to Louisville, Kentucky to meet with Tara, who is a recovery advocate, and other members of the nonprofit Young People in Recovery program.
When I started using heroin, it was not even 4 months. And I had lost so much weight. I was about 100 pounds, if that. I could literally eat half of a McChicken from McDonald's and be full. And I ended up in the hospital twice due to an overdose. The first time my respiratory shut down, and the second time my respiratory shut down, and so did my heart. It stopped, and it took them intubating me and this special combination of medications in a bag to wake me back up. It had gotten to a really bad point. And that's pretty much when, not exactly I realized that there was a problem, but that there was something wrong, that people don't live this way, And it wasn't necessarily that I thought I was sick, that I thought that I had a substance use disorder. It was more like I just didn't understand why I couldn't have a normal life like everyone else, and why I couldn't identify with that.
So what was your health like when you were addicted?
Well, I thought my health was great, because I was blinded. But I did end up ODing, and that's what ended up pushing me into recovery. Not that I stayed sober then, but that's whenever I really wanted to get sober. So I OD'd, and after, like I said, I thought I was healthy the whole time, but once I got sober, I ended up getting checked out, and I do have hepatitis.
Well, growing up, I always was active in sports, that type of stuff, and I was always a healthy individual. So starting out, my health was fairly good, fairly decent. I'd like to say it was immaculate, but probably not so. And as I continued to use drugs and alcohol, it actually led me down to basically 135 pounds, and I was malnourished. The color basically left my skin. I was very pale. So yeah, it basically ate my health.
One particular time, I had been for multiple days using different drugs, and I woke up and had this severe stomach pain, and I didn't know what it was. I could not stand up. I could not straighten my body out, and I felt sick, like I was going to throw up. And I crawled to the bathroom to try to be sick, and it wouldn't happen. And there was luckily somebody there at the house, and I crawled back and could not get back in the bed. I was stuck on the floor, and I yelled for them to wake up, and they literally had to pick me up in a ball, put me in the truck, and drive me to the emergency room. When I got there, they did some tests on me, some different things, and a surgeon comes down to my room. And he's standing in the room, and he's looking at me, and I'll never forget, because one of the first things he said to me, "Any drugs you don't do?" And I remember just like looking at him like, well, what's going to happen next? And what he told me is I had a perforated ulcer. My stomach had ate through the lining, and now all of my stomach acid was in my abdomen, and that I was going to die if I did not have surgery. And there was a chance that I might not be able to make it through the surgery either. And so at that point, because of the depression that my drug use caused in me. There had been multiple suicide attempts before that. And in that moment, I was like, I don't want to die.
After hearing the stories from people in recovery, I decided next to talk to health professionals about what they were seeing in their field. I first met with Dr. Robert Wells, an anesthesiologist. And then tell me about some of the complications that a person abusing drugs has when undergoing anesthesia.
The biggest thing really is, you always have the potential withdrawal because they're going to be in the hospital and they're not getting the drugs that they're used to having. And as far as during the anesthesia, their body has built up a resistance to the narcotics, so the medicines we give for controlling pain, both during the surgery and after the surgery, don't work as well. And unfortunately, that's the biggest problem they have post-operatively, is that you cannot control the pain because you can't give enough pain medicine to get their pain under control because they've built up such a tolerance to it.
I then met with Dr. Michelle Lawfall to talk about some of the advances we are making in the recovery process for addicts.
Buprenorphine is one of the FDA-approved medications, and when it was initially approved, it was approved as sublingual tablets. So they're tablets that get dissolved underneath your tongue and they get absorbed by the blood vessels underneath your tongue. And then there was a film product that goes underneath your tongue, and then there's a product that goes onto your cheek, but they're all buprenorphine. And then, but like with any oral medication, there's always a problem with people remembering to take it, or someone can decide not to take it if they want to go and use, and they're no longer going to be protected, against having a fatal overdose. Because one of the really positive things about buprenorphine is that it blocks the effects of another opioid while someone's taking it. So if they were to have a slip or a relapse and they were to use heroin on top of their medicine, it wouldn't be able to bind to the receptors because the medicine would be there. It's kind of trying to make it really simple. And naltrexone would do that same thing. But both of those medications rely on taking it every day. And if you forget to take it, like many people do with all medicines, hypertension, diabetes, adherence to medications is a huge problem, then it's not going to be as effective. So there's been a great desire to make medications that are not involving remembering to take it. So naltrexone, we have a shot that's once a month, so that people just have to remember to go to their doctor to get their shot once a month, or a nurse practitioner or PA can give that shot as well. With buprenorphine, we don't yet have that, but what we did was just recently approved by the Food and Drug Administration. It was something called, is a buprenorphine implant, and the trade name of it is Probufene. My thumb, and 4 of these get implanted underneath the skin, right in your bicep, right next to each other. And it takes about 10-15 minutes to insert them. It's just a minor outpatient procedure. And then they stay in there for 6 months. They have to be removed after 6 months. But then people don't have to remember to take their medicine every day. It's kind of like they just have it in. They don't have to worry about losing it or having it be stolen. And the other really great thing that's happened within the last year is that in October of 2015, addiction medicine was recognized as a special subspecialty within the American Medical Association. So that was a really big deal, that it's recognized as part of the big house of medicine that addiction medicine is, and it is actually a subspecialty under preventative medicine. Because we know that people with substance use disorders that don't get treatment, they are at more than double the risk of many chronic health problems like arthritis and chronic pain and diabetes and hypertension. So by treating addiction, you actually prevent other health problems.
Back to the numbers. What is the financial burden this is costing hospitals, physicians, and taxpayers?
Absolutely, there's a financial burden. I don't know if you're familiar with the EpiPen scandal that came down where they increased the price to some astronomical cost, but in supply and demand, Narcan, I'll show you a picture of it later, went from, in 2009 when I was first started here, it was $4 a dose. Now it's $38 a dose. So you've seen a huge increase because it's become, heroin has become so rampant. The need for Narcan has become rampant, and the drug companies have increased the price. It's gone up from $12. I mean, it went from 4 to 8, 12, and then last year it was 12. Now it's 38. And I haven't seen them lower it yet, so I wouldn't be surprised if they keep it up. You got to have it, supply and demand. Unfortunately, it's a life-saving drug, and they still take advantage of it.
Replacing a heart valve is a very expensive surgery and hospital stay, and most of the patients do not have insurance that are abusing the drugs, so therefore it falls upon the hospital and the physicians that are taking care of them to basically take care of them for free.
This epidemic is all about the numbers. How do we prevent the 1,000 people dying from overdoses each year in Kentucky? How do we stop this spending of millions of dollars on surgeries and health problems when it is not fixing the underlying problem? And the last number to remember is the 2.1 million people that had emergency visits from a drug overdose every year. Will we let this number rise, or can we turn it into the number 0?